The nursing process, narrated by Shiver. During this lecture, I'm going to explain what the nursing process is. I'm going to identify the steps used in the nursing process, and hopefully by the end you'll have some tools that you can use to help better understand and utilize the nursing process in your practice. The nursing process is very unique to nursing. It is a systematic approach that nurses use to gather patient data, critically examine and analyze the patient's data, identify the patient's response to a health problem, design expected outcomes and interventions, take action, and then finally evaluate whether the action is effective. This is essentially the blueprint for all client care. The nursing process has 5 distinct steps. Something that's important to keep in mind is each step is dependent on the preceding step. Nurses always assess first. So assessment is the first step, followed by diagnosis, or more specifically, formulating a nursing diagnosis. Then we plan, then we implement, and then we evaluate. Let's look at assessment a little more in detail. This is when we're gathering information about the patient. We're examining the data we've collected. We're doing our assessments of the patient, the physical assessment. We're looking for things that don't fit the picture or something that's abnormal. When we're doing our assessment or gathering our data, we may collect information from primary sources, which is usually the patient, or it might be secondary sources, such as the patient record or chart, or maybe family members. Something to keep in mind though, nurses always assess first. There are different types of assessment. We may be doing a focused assessment. This is where we obtain detailed information about a specific condition. And the example I like to use is if you have a patient with a fractured leg, well then you're going to focus on edema and color and sensation of that extremity and pain. With a full assessment, it is different in that you're doing a complete physical assessment. If your patient has a fractured leg and we're doing a focused assessment, I would not anticipate that you would check their pupils. But with a full assessment, you would assess everything the patient has. This is different from a baseline assessment. Baseline assessments are generally gathered on initial contact, and this is usually done by the registered nurse. This is where we gathered all information about the patient, which includes social history, past medical history, allergies, current medications. So your baseline assessment is all inclusive. There are 2 types of data that we may collect. The first being subjective, or what the patient tells you. I always remember subjective is said, or subjective is statements. So if the patient says they're having pain, or the patient says they're itching, that is subjective data. On the other hand, we have objective data. Objective data can be tested or measured. Objective is often observed. And examples of objective data would be your blood pressure readings, your lab results, or any assessment findings. So it's essentially anything you collect or observe. Once we've collected all our data, we need to analyze it and look for patterns or trends. What stands out as being different? Have we identified something right away as being abnormal? Or do we see a trend of something that's going on with the patient? We need to compare our assessment data to standards or norms. For example, maybe your patient's blood pressure is 168/102, but we know that's a little high. We want it closer to 110/70. Or maybe when auscultating the lungs, we heard adventitious lung sounds or rales, but we should have clear lung sounds. So what we've done is identified problems. Once we've identified problems, which are defined as an unmet need or anything that interferes with a person's ability to meet their needs, then we can formulate our nursing diagnosis. So once our problem is identified, we create a nursing diagnosis using NANDA. NANDA stands for the North American Nursing Diagnosis Association. Using NANDA, this provides the basis for selection of nursing interventions, and it helps facilitate our creation of a nursing diagnosis as well. Please keep in mind that nursing diagnosis may address an actual, meaning a problem that actually is happening, or a potential problem that could occur. When creating a nursing diagnosis, it is stated in a two-part format. The first part is going to be the diagnostic statement. Risk for injury is the example I have listed here. If you were to go online and Google NANDA, go to their website, you actually can access hundreds and hundreds of diagnostic statements. Please keep in mind that each patient may have several nursing diagnoses that apply to them. The second component of a nursing diagnosis is going to be the related factors, or the etiology. This must be within the domain of nursing practice and a condition that responds to a nursing intervention. So I've got, for example, here, related to is the RT, generalized weakness. So if you put the two components together, we would say the patient has a risk for injury related to generalized weakness. Let's do a case study here. You're caring for a 76-year-old female who's been admitted to the hospital after falling at home and fracturing her left hip. She complains of severe leg and muscle pain. She does have orders for traction, a Foley catheter, and pain medication, and she's scheduled for surgery in the morning. Her medical diagnosis from the physician is fractured left hip. We need to create a nursing diagnosis for her. I've got a couple examples that would apply to her. Based on NANDA criteria, her actual problems she is having now, may include acute pain related to muscle spasms, impaired physical mobility related to limb immobilization, and there could be many, many, many more. Her potential problems, they're not happening yet, but it could happen. She's at risk for impaired skin integrity related to altered sensation, or risk for infection related to invasive procedures. She's going to have a Foley catheter and also a surgical wound. I did list some NANDA do's and don'ts. When creating a nursing diagnosis, don't be legally incriminating. For example, don't say risk for injury related to lack of side rails. Well, that's pointing your finger back at yourself, basically. Also, don't use medical diagnoses. Mastectomy related to cancer. When you're creating a nursing diagnosis, you never use a medical diagnosis as a component. You do want to focus on the person's response to medical problems. For example, body image disturbance related to the effects of the surgical procedure. So that would be an appropriate nursing diagnosis. Also, when you're creating a nursing diagnosis, focus on one problem. Don't use two problems at the same time and create a nursing diagnosis. That just makes it harder. So one diagnosis per problem. Don't just come up with a diagnosis either. You must be able to support it with your assessment data. So you must be able to support it with the findings that you have from your patient. Step 3 in the nursing process is planning your goals. And these goals are patient goals. So what we need to do is develop realistic, and that's a key word, realistic, patient-centered goals. So the first part of our statement or our goal will be the patient will. The next component of the patient goal is we need to have some measurable goal criteria. And the example I have here is report hip pain less than 3 on a 1 to 10 scale. It is measurable because we can measure on that 1 to 10 scale. The third component of your goal needs to include the time frame. Some goals will be more appropriate to have a short time frame, such as we would want pain relief in a shorter period of time. If the goal was related to weight reduction, well then that would be a longer period of time most likely. The complete patient goal would read, the patient will report less hip pain within 1 hour, as evidenced by a pain rating less than 3 on a 1 to 10 scale. It has all 3 components, but it also could be rewritten. The patient will report pain less than 3 on the 1 to 10 scale within 1 hour. As long as it has the 3 components, it doesn't matter what order you put the patient goal in. This is a template that you could use when you're creating patient goals. The patient will what? By when, as evidenced by, there you would state your measurable goal. Step 4 in the nursing process is the actual implementation. This is where we get to do whatever we're going to do to help the patient. So it's the actual process of putting the plan into action, and it is a team effort. This includes reporting, performing the care, setting priorities, documenting, assessing and reassessing, and also adhering to policies. In other words, what actions are we going to take to help the patient reach their goal? The nurse will. If we're referring to our previous patient, the nurse may give the patient Demerol 25 milligrams IM, Q6 hours. The last step of the nursing process is to evaluate. This is when we determine if the expected outcomes were met. It is an ongoing, continuous process because we're continuously reevaluating our patient's goals to see if they're being met, or maybe we need to change the patient goals. It is possible that we have set unrealistic goals for that patient and they may need to be changed. When evaluating, we either meet our goal, we partially meet our goal, or we don't meet our goal. If you do not meet your goals or your patient does not meet your goals, that's okay. Maybe they weren't appropriate for that patient, or maybe they need to be adjusted, or maybe we need to change what we're doing to better facilitate the patient reaching their goals. Let's see what we've learned. I've got several potential nursing diagnoses listed here. Some are actual nursing diagnoses and some are not, and we're going to talk about why they may be or why they're not. The first one is risk for injury related to sedation. That is a nursing diagnosis. Altered gas exchange related to COPD. That would not be an appropriate nursing diagnosis because it contains a medical diagnosis. Risk for falls related to hazards in the home would be an appropriate nursing diagnosis. Imbalanced nutrition, less than body requirements related to poor nutritional intake, although long, it is an appropriate nursing diagnosis. How about decreased cardiac output related to CHF? There's a medical diagnosis again, so that is not a nursing diagnosis. Altered mental status related to dementia is not a nursing diagnosis. Rhonchi related to bronchitis is not a nursing diagnosis. Each of those last cases, they were using medical diagnosis in its place. How about these goals? Are they appropriate? Patient's O2 sat will be greater than 95% by the end of the shift. It's about the patient. We have a measurable goal and we have a by when, the end of the shift. So yes, that is an appropriate patient goal. Patient will ambulate twice daily. It's about the patient and it says when, but it doesn't tell us how far. So it's not an appropriate patient goal. If we were to say how far we wanted the patient to ambulate twice daily, then it would be an appropriate goal. Patient will run 5 miles daily. It's about the patient. It says how far and it says how often, but you have to ask yourself, is this realistic? To have a patient and expect them to run 5 miles daily? That one's kind of tricky, so it may not be realistic. Patient will report no leg pain on the 1 to 10 scale in 2 hours. It's about my patient. I've got it measurable. We're going to look at the 1 to 10 scale, and it's within 2 hours. So yes, that is an appropriate goal. Patient's oral temperature will be 98.6 degrees Fahrenheit in 1 hour. When you first look at this, you'd probably say, well, yeah, that's an appropriate goal. But how hard is it going to be for us as the nurse to make sure that temperature is 98.6? As it's written, no, that would not be an appropriate goal. What we could do to fix that would be to include a range of temperatures. Maybe we'd want it to be from 97 to 99 degrees Fahrenheit. So when you have a situation like that, when you're talking about a blood pressure or a heart rate or something that fluctuates, it might be better to include a normal range or your goal range instead of a specific number.